In this video we will show you burn treatment, how to treat a burn naturally. Burns are a common but extremely painful injury. While minor burns will heal without much medical attention, severe burns require special care to prevent infection and reduce the severity of scarring. Before you treat a burn, it is important to understand what kind, or degree, of burn you have suffered. Part 1: Determining the degree of your burn. 1. Figure out if you have a first-degree burn. First-degree burns are the most common and happen as a result of light scalding, brief contact with hot items, and the sun. The damage is only on the most superficial or outer layer of the skin. They will likely appear red, slightly swollen, and may or may not be slightly painful. First-degree burns are classified as minor burns and should be treated as such. Sometimes you may get an extensive first-degree burn, such as full-body sunburn, but this does not need medical attention. 2. Know if you have a second-degree burn. Your skin might also appear blotchy, blisters will form, and the pain will be much more intense. Second-degree burns come from brief contact with incredibly hot things, boiling water, for example, extended contact with hot items, and prolonged exposure time in the sun. A second-degree burn burns through 2 layers of your skin. If your second-degree burn is wider than 3 inches, covers your hands, feet, joints, or genitals, or doesn't heal over several weeks, then you should call your doctor for medical help. 3. See if you have a third-degree burn. Third-degree burns are the most serious and need immediate medical attention. These happen when extended exposure to a hot object burns through all 3 layers of your skin, sometimes causing muscle, fat, and bone damage. The burns will look leathery and have a white or black appearance. 4. Check low-temperature burns. These are burns that occur when your skin is exposed to low temperatures, like snow or ice, for an extended period of time. The area will look bright red, white, or black and will have a strong burning sensation as the skin is rewarmed. A low-temperature burn is still considered a burn because it damages the skin's tissue layers. Treat low-temperature burns as major burns in most cases, and get medical help for treatment. Rewarm the skin in 37 degrees Celsius / 98.6 degrees Fahrenheit to 39 degrees Celsius / 102.2 degrees Fahrenheit water immediately after exposure. 5. Determine if you have a chemical burn. Chemical burns are another type of burn caused by skin contact with harmful chemicals that damage the skin layers. These types of burns will probably appear in the form of red patches, a rash, blisters, and open sores on your skin. Your first step is always to determine what caused the burn and to call poison control immediately. Contact a poison control center immediately if you believe you've suffered a chemical burn. Care must be taken to neutralize and isolate the spread of the chemical. Irrigate chemical burns with lots of water. However, avoid water if exposed to dry lime or elemental metals, such as sodium, magnesium, phosphorus, lithium etc., as these can react with water and cause more injury. Part 2: Treating minor burns. 1. Run cool water over the burn. As soon as you can, run cool water over the burn. This will prevent further damage to your skin. Stick the burned area under cool running water for 10-15 minutes or until the pain subsides. Avoid using cold water, since this can damage the skin around the burn. The sudden shock of extreme heat to extreme cold will only slow the healing process. 2. Remove tight clothing or jewelry quickly. As soon as you can, or while rinsing the burn, remove anything that might constrict your skin as the wound swells. When in doubt, take it off. This lets blood flow to the wound and starts healing it. Removing tight clothing or jewelry can also prevent further damage. 3. Apply a cold compress. If cold water isn't an option, use a cold compress or ice pack wrapped in a towel. Place it over your burn. Apply the compress for 10-15 minutes, wait for 30 minutes, and then reapply for 10-15 minutes. Never apply ice or your compress directly to the burn, since this will damage the skin. Keep the towel between you and the ice instead. 4. Take an over-the-counter pain reliever. An over-the-counter pain reliever such as ibuprofen, acetaminophen, aspirin, or naproxen can be helpful if the symptoms are bothering you. If the pain does not lessen after several hours, take another dose of the medication. Avoid giving aspirin to young children or if you are recently recovering from the flu or chickenpox. Follow the specific package instructions. They'll be different depending on what medication you choose. 5. Clean the burn. After washing your hands, use soap and water to clean the burn and prevent infection. Apply an antibiotic like Neosporin when you are done to keep the burn clean. Aloe vera can also soothe your skin. Look for aloe vera with few additives. Antibiotics or aloe vera can also keep the bandages from sticking. Do not pop blisters while you clean since they actually protect your skin from infection. Take care not to pop the blister or drain the contents, since the body is able to take care of minor blisters on its own. Antibiotic ointment isn't needed if your blisters haven't popped. But, if they have or if your wound is exposed, use an antibiotic to prevent infection. 6. Lightly cover the burn with ointment and then gauze. You may not need to apply a bandage to first-degree burns, blisters that haven't popped, or skin that isn't exposed. But small second-degree burns will need a wrap to keep out infection. Cover the burn lightly with gauze and secure it softly with medical tape. Change the gauze daily. 7. Avoid using home remedies like egg whites, butter, and tea. The internet is awash with miracle solutions for burns, but few scientific studies have actually proven them to work. Many reputable sources, such as the Red Cross, found them to be worse for burns because they contain bacteria that can lead to infection. Natural moisturizers such as aloe vera or soy may be helpful in cases of sunburn. 8. Watch the burn for infection. Keep an eye on the wound for changes in color to red, brown, or black. Also, watch for any green discoloration of fat layers under and around the wound. Seek medical attention if a burn does not heal over several weeks. A burn that refuses to heal can be a sign of complications, infection, or a more serious burn. 9. Alleviate itching with topicals. Itching is a common complaint among patients during the initial healing period after minor burns. Topicals such as aloe vera or petroleum-based jelly can soothe the discomfort caused by itching. Oral antihistamines can also be taken to help with the itchiness. Thanks for watching. Subscribe our YouTube channel for more videos.